Good day, Bahamas. This is Orinthia Komalafe, DNA Leader. Today is Thursday, August 6, 2020. The Democratic National Alliance has provided recommendations on the protection and training of frontline workers, mass testing, border closure, travel restrictions, self-isolation, mandatory quarantine, and measures to address the economic fallout from COVID-19. The drastic increase in the number of COVID-19 positive cases since the reopening of our borders is disturbing. The numbers are simply staggering. Since the botched reopening of our borders on July 1, 2020, confirmed cases have increased by 622%. Hospitalized cases have increased by 1,800%, and active cases have increased by 16,000%. COVID-19 related deaths have increased by 27%, tests completed by 94%, and recovered cases have only increased by a mere 2%. Today, Bahamas Nurses Union President confirmed that an entire ward of patients at the Sandilands Rehabilitation Center tested positive for COVID-19. This comes on the same day that nurses in Grand Bahama reportedly called in sick, and the Commissioner of Police confirmed that more than 100 police officers have been placed in quarantine since our borders were reopened. Technicians at the Princess Margaret Hospital also staged a walkout today in protest of insufficient protective gear. This follows the initial walkout by doctors at the Accident and Emergency Unit at PMH, the exposure of immigration officers, and concerns about other civil servants. What is going on in our Bahamaland? Professionals at the forefront in the fight against COVID-19 have been significantly impacted by this pandemic. They have lamented the lack of adequate resources and protective gear for months. This is unfortunate, unacceptable, and irresponsible in the midst of a pandemic. We call on the government to provide frontline workers with the requisite resources immediately in the interest of public health and safety. These individuals have families and are making sacrifices daily to keep us safe. They should not be taken for granted. Governance is not easy, and leadership is not a bed of roses. Leaders are called upon in crisis to show competence, inspire hope, ensure stability, and exude confidence. The negligence and failure of our government is not the topic in this case. It is their lack of empathy, compassion, and listening ears. We look up to God for the protection, healing, and sustenance of our people.